just to also recap, the achievement gap is there in the first grade. So that's the reason to do the screening at the end of kindergarten, because the gap's not going to go away. You want to try to close that gap, and the best time to do that is in the first grade. We're trying to get first graders in the evidence-based instruction for a dyslexic child. So let's talk a little bit about what that looks like.
Well, we've had over 20 years of experience about talking about interventions for dyslexic students. The 20 years ago, the report of the National Reading Panel reviewed all the evidence at that time and said that in order to read, a child must be taught alphabetics, which consists of learning about phonemic awareness and phonics. They need to learn how to read fluently. They need to know something about the vocabulary, and they need to comprehend what they're reading. So these sort of 5 elemental skills are critical for reading, and we've known this for 20 years. Now, the trick is how do you actually provide this? How do you get this? And one of the reasons, and in addition, you want to do that. We've learned that effective reading intervention has to be done early. You have to use evidence-based methods. You have to have knowledgeable teachers. You have to have intense instruction, and the instruction has to go along for a sufficient duration. It turns out that that's not easy, and I think, Dr. Cassidy, you are in a good position to discuss this, because Louisiana Key Academies, which are now several around the state, are providing this kind of intervention. What you're able to do, because your specialized centers, is you do have knowledgeable teachers. I think it's and it's critical. And school systems that don't have the availability of something like the Louisiana Key Academy, they're going to have to develop a cadre of skilled teachers, and in some way get these children into evidence-based reading programs that will allow the children to advance, to sort of really learn to read. And that, as I think Dr. Cassidy can attest, is not easy even in a specialized school like Louisiana Key Academies. So I think that's the trick. And I know Dr. Cassidy is trying to have the Key Academies centers for teaching other schools about teaching children to read. But I mean, I don't think this is not something that is easily done if you want to have success.
Yeah, so I think you're great points, because I will brag on Louisiana. The department is paying for teachers to go through teacher training. Ideally, it is a 2-year training so that you become a certified academic language therapist. It is hard. It's a lot of work. It's the class seat work plus the 7 hours practicum, but that makes a knowledgeable teacher that can instruct the dyslexic. And the real hope is that we would have these academic language therapists throughout the state to be able to service all the kids, so they can do those 5 areas that Dr. Shaywitz talked about, which is the phonemic awareness, the phonics, the fluency, the vocabulary, and the comprehension. And at Louisiana Key Academy, based on Dr. Sally Shaywitz's recommendation with the National Reading Panel, it's 90 minutes of instruction 5 days a week. And that would be the gold standard.
Well, I think that's really important, Dr. Cassidy, really emphasize that. I can tell you that we are in the process of, we have a paper under review where we looked at our longitudinal study, and we looked at the interventions that were being done at the time that the children in a longitudinal study were in grade school. And what we found is that and we can measure their reading when they're in their 40s. And what we found that the school interventions that were being used then, and many of them are still being used, were not very effective. They didn't seem to influence the reading when the children became adults. And so you really need more than the kinds of school-based programs that were used and are still being used. You need a much more a much more evidence-based, a much more intensive kind of program. And I think the program that Dr. Cassidy is talking about, and I think it's lucky that you have the key academies, because you can there are NIDAS and centers to get teachers trained, because unless you have knowledgeable teachers who sort of know what they're doing and can provide this intensive instruction, you're not going to have much success with getting the dyslexic children to read. So I would really emphasize that you've got to do a much more intensive, a much more evidence-based, something that goes on for a substantial period of time, that's more frequent and more intensive. And that's what you really need. Because the simple programs that schools were using when longitudinal study children were in grade school, and they continue to use, are just not effective. We don't have the evidence that that's kind of, those simple interventions are not going to be effective. So you need the kind of interventions that Dr. Cassidy is providing in the LKAs and extending out into the other systems, into the public school systems in Louisiana. What impresses us is the system that you've developed in Louisiana is unique. It's not, but it's just starting to be used in some other states, but it really is unique. And I think it's the best chance of getting these dyslexic students to learn to read.
And I will say, for people that don't know, so the teacher training can be used with different curriculums, but the curriculums that are evidence-based have this Orton-Gillingham component that has those 5 components we talked to. But with working with the Shaywitzes, we also know that we have to have really robust vocabulary instruction, really robust oral discussions, and also time for the child to read aloud during the 90 minutes with feedback, and also at home. That read aloud connected text has really been a push for this comprehensive 90 minutes to get these kids what they need.
That's a very important point. It just means that it's not as simple. It's not just simply providing 3 weeks of a pull-out program in a school. That's not going to work. You're going to need this much more intensive program that Dr. Cassidy is talking about. And it's doable. I mean, she's shown that it's doable, and she's going to prove that it's doable in the rest of the state. So I think that's really that's very, very unique, and I think that's going to be the model for the country.